Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Why can't I stop coughing and how do I stop? There are many possible reasons why you can't stop coughing. The most common include a viral infection, allergies, asthma, chronic bronchitis, and gastroesophageal reflux disease. Treatment with certain medications such as ACE inhibitors can also contribute to a chronic cough. /r/n/r/n A chronic cough, also called nagging or nonstop cough, is one that lasts for 8 weeks or longer. Most chronic coughs aren't serious and will resolve over time. In the meantime, you can treat a chronic cough with over-the-counter remedies like cough drops and cough suppressants or home remedies like steam and honey. /r/n/r/n This article describes some of the common and uncommon causes of a non-stop cough. It also explains how a chronic cough is diagnosed and treated and when you should see a healthcare provider. /r/n/r/nVerywell, Junior B/r/n/r/n Causes of a chronic cough can range from those that are a nuisance to those that are potentially life-threatening. Even so, the greater likelihood is that the cause is not serious or, at the very least, manageable with proper treatment. /r/n/r/n Allergies /r/n/r/n Asthma /r/n/r/n Bronchitis /r/n/r/n Chronic obstructive pulmonary disease, COPD /r/n/r/n Emphysema /r/n/r/n Gastrointestinal reflux disease, GERD /r/n/r/nHiatal hernia /r/n/r/n Lung infections /r/n/r/n medications /r/n/r/n pneumonia /r/n/r/n post-nasal drips /r/n/r/n whooping cough /r/n/r/n congestive heart failure /r/n/r/n collapsed lung /r/n/r/n fungal infections /r/n/r/n lung cancer /r/n/r/n pulmonary edema /r/n/r/n tuberculosis/r/n/r/n One of the most common causes of uncontrollable coughing is an infection with a virus or bacteria. Less common causes include fungi and parasites. /r/n/r/n Examples include /r/n/r/n coughs can be triggered by an abnormal response of the immune system. /r/n/r/n Seasonal allergies, including allergic rhinitis, hay fever, can cause a chronic cough. Environmental allergies to mold exposure, dust mites, and cat dander can also cause chronic coughing. /r/n/r/n Asthma is a chronic condition that causes the airways to swell. Asthma can make it difficult to breathe, which can trigger coughing. /r/n/r/n COPD is an important cause of a chronic cough, often accompanied by shortness of breath, wheezing cough, and chesty cough. Smoking is both a cause of COPD and a trigger for COPD exacerbations, attacks. /r/n/r/n This is a condition that occurs when the airways become damaged and widened. Causes of bronchiectasis include prior childhood infection, immune deficiency, and conditions like cystic fibrosis or connective tissue diseases. /r/n/r/n Acid reflux, whether occasional or chronic, can cause coughing due to the backflow of stomach acid through the esophageal sphincter. This is the valve through which food passes from the esophagus, feeding tube, into the stomach. /r/n/r/n GERD is a chronic form of acid reflux. Chronic coughing can occur at night when lying down. It's followed by a hoarse cough in the morning due to esophageal inflammation. /r/n/r/n/Hiatal hernia is when part of the stomach protrudes into the chest through the sheet of muscle called the diaphragm. Hiatal hernia can disrupt the normal position of the esophageal sphincter, allowing acid to backflow into the esophagus. /r/n/r/n medications called ACE inhibitors used to treat high blood pressure and heart failure can cause chronic coughing both during the day and at night. /r/n/r/n ACE inhibitors associated with chronic coughs include /r/n/r/n less common causes of a constant cough include /r/n/r/n the underlying cause of a nonstop cough must be diagnosed before it can be successfully treated and cured. However, there are also things you can do to relieve the symptoms of a cough temporarily. /r/n/r/n Here are some home remedies, over-the-counter medications, and prescription medications that can soothe or cure a cough. /r/n/r/n If you have a nagging cough, you may be able to get relief at home with simple remedies. Some of the things that might help include /r/n/r/n For mild coughs, you can try over-the-counter medications. Examples include /r/n/r/n notes that cough and cold medications aren't recommended for children under the age of 4. /r/n/r/n Your healthcare provider may decide you need prescription medication to help control your cough or the underlying condition that is causing it. Some of these medications include /r/n/r/n The Federal Drug Administration does not recommend over-the-counter cough medicines for children under the age of 2. This is because there is a much higher risk of serious, potentially life-threatening side effects in very young children. /r/n/r/n If in doubt, check the manufacturer's label. Kids' cough medicine labels often say that the products shouldn't be given to children under age 4. Children should never take a cough medicine meant for adults, since it can overdose a child. /r/n/r/n Home remedies can help ease your child's cough. Some of these include /r/n/r/n You should not give honey to a child under the age of 1 year. This is because of the risk of botulism, a dangerous bacterial infection. /r/n/r/n Always ask your child's pediatrician, or another healthcare provider, before giving a baby or young child an over-the-counter medication. Honey, eucalyptus oil, vapor rub, and steam can be dangerous in children and infants. /r/n/r/n Most causes of a cough resolve with treatment and time, but see a healthcare provider if you are still coughing after 8 weeks and you're also experiencing symptoms such as /r/n/r/n If you experience these symptoms, get emergency medical attention. /r/n/r/n When you see your healthcare provider, the first thing they will do is review your symptoms and medical history and perform a physical exam. This may include listening to lung sounds with a stethoscope. /r/n/r/n The features of a cough see and differ based on the underlying cause and may be described in different ways. /r/n/r/n When you have a wet, productive cough, you bring up phlegm when you cough. Your cough may be described as rattling or congested. /r/n/r/n When you have a dry, unproductive cough, you do not cough up phlegm. Instead, your cough may be hoarse, hacking, or barking. /r/n/r/n Cough may have other descriptive features such as painful, wheezy, or paroxysmal, occurring in fits or attacks. /r/n/r/n Accompanying symptoms may include fatigue, shortness of breath, dyspnea, heartburn, nausea, fever, and nasal congestion. These and other features can give your health provider a clue as to the cause and nature of your cough. /r/n/r/n Based on the findings, the healthcare provider may order the following tests and procedures. /r/n/r/n A chronic cough is one that persists or recurs for more than 8 weeks. There are many possible causes including infections, allergies, asthma, COPD, GERD, and even certain medications. Less common causes include tuberculosis and cancer. /r/n/r/n. The diagnosis of chronic cough may involve a physical exam, blood tests, chest x-rays, nasal swabs, or direct imaging procedures like bronchoscopy or laryngoscopy. /r/n/r/n. The treatment varies by the cause but could include simple home remedies such as steam or honey. Over-the-counter medications like cough drops or expectorants may help provide relief. In some cases, your healthcare provider may decide you need a prescription medication such as an antibiotic or an inhaler. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.